So we talked about the three models of toxicity, which is a dose-dependent model, meaning a lot of toxin is really bad, a little bit is fine. We talked about the buildup model, where a little bit from many different sources over time can actually create a problem. And we talked about the immune model of toxicity, where the immune system can actually think a toxin is a bad guy, like a bacteria or virus, and react to it like you're having a cold or a flu, creating inflammation in the body. Because a lot of people ask me the question of, why don't we talk about this in our current healthcare model? And unfortunately, it's a complex subject with a lot of moving parts, and there's not a drug for it. There's not a medication for a toxic buildup, and there are unfortunately political and even big company gains with using these products that sort of squash any public acceptance that this is an issue. So another question that I often get is, can we test for toxins? And this is unique really to every person. It always involves, are there any known exposures with people? What's someone's history? Are we looking for certain toxins like mercury or mycotoxins from mold? But we can measure these. We can measure them in a variety of different ways. If we're looking for a big, heavy, acute exposure, we might measure it in our blood. If we're just looking at how the body is processing daily toxins out, we might measure it through the urine. We might even do a challenge with some detox support like glutathione before doing the test to see what the body is trying to excrete. We can measure heavy metals. We can measure the presence of over almost 200 different persistent toxic chemicals in our environment, including pesticides, phthalates, benzene, perchlorate, you name it, we can measure it. It can get quite extensive. And I always like to customize the testing for what the patient's potential exposures might be. A very common one that we test for is glyphosate, which is commonly known as Roundup, which is what we spray to kill weeds or what we spray on our foods.